Because your large machines like MRI, CT scan, cath lab, all expensive machines need X amount of work to become profitable. And you need at least 10, 15 MRIs to be done daily, 10, 15 CT scan to be done daily, and that happens with 200 beds. Another thing, all your secondary care, medicine, surgery, gynec, orthopedic, ENT, pediatric, you need at least 3 doctors each. You need at least 3 doctors each to divide emergency. And we work with the full-time model, and we don't encourage visiting model much, which is very prevalent in Mumbai. Because then that doctor will not let you earn. He doesn't belong to hospital, patient doesn't belong to hospital. We work with the full-time model, and that works much better for hospital as an industry. Now, as I said earlier, what is our expansion strategy? So wherever we want to go, we start our outpatient clinic, we do CME programs, we do a lot of things, camps, activities. Like presently, we have a lot of patients coming in from Lucknow, Varanasi, Patna, Calcutta, and then these are all future areas where we will be going in a coming time, because people then want us to go there. That's saying, why you are not coming here? As I said earlier, that we have 100 patients coming from Mumbai every month to get operated in Ahmedabad. Now they are saying that how long we will come. So we are coming up with 2 units in Mumbai, one in Santa Cruz and one in Ghatkopar. Now why to expand? This example I want to give you. In 1984, when the first Apollo started in Chennai, 300 open heart surgeries were done in Chennai, 100 in Mumbai and 100 in Delhi, total 500 surgeries. 10 years later, 5,000 surgeries were done. Further 10 years later, 50,000 surgeries were done in India. And by 2014, 200,000 open heart and 800,000 angioplasties, because angioplasty started late. By 2000, it started. So 1 million procedure from 500 in 30 years. It is more than 35-40% CAGR consistently for 30 years. Whomsoever were there at that time probably did not take much advantage of this. They could have taken, but they have not taken. Similarly, joint replacement. It happens in Western world a little differently. It took 30 years in India. It takes 5 years in US or UK when something new comes, because of availability of infrastructure and awareness, both. As far as joint replacement is concerned, when I came back in 94, India did 300. Last year, India did 160,000. We did 9,000 out of it. India will be doing more than 1.5 million joints in a coming time. Why? Why I'm saying so? Because in US, for a 30 crore population, they are doing 800,000 knees and 800,000 hips in a year. Indians suffer 15 times more from arthritis knee than Caucasian population. We don't get arthritis of the hip. So hips will not grow, but knee will grow 15 times. Now you say 15 times multiplied by 8 lakh. 8 lakh because our paying population is 300 million like US number. Now if you consider that, we are talking about more than 90 million, or 9 million, but I'm conservatively putting 1.5 million for 10 years. Now we are the biggest brand, we have biggest chance to take advantage of it. And if you can take advantage of such situation only and only if you are capital efficient and you are able to keep your margins intact, which we are able to do it since last 10 years. Same way, there are two other branches where the maturity has not yet happened. Orthopedics, there are 5 things other than joint replacement, spine surgery, or arthroscopic surgery, or trauma, which is going to grow at 15-20%. Cancer surgeries, which will grow again 15-20%. And neuron and neuro-related surgeries will grow 15-20% from now to 10-15 years. And that is the advantage we have, because we have created infrastructure now. We are able to attract a lot of doctors, and even To attract further doctors, we have shifted our 1.5% equity as a Shelby Medico Trust to give away to doctors who are performing well. As far as government is concerned, I had been asked a number of times that government is anti-healthcare. Government is not anti-healthcare. Whatever Indian government has done in last 5 years, this government and even past government, there was 150% accelerated depreciation until last year. We still enjoy 100% depreciation. Since last 2-3 years, we are in MAT. Coming 5 years, 7 years, we are going to remain in MAT. So available cash profit will be very high for us. The other thing is, in employment, they pay for employees' PF. So that much is negated. Even 25,000 rupees or less pay, 33% tax rebate they give. These are two things which have been done in last budget. And lastly, but not least, is PM's announcement of 500,000 rupees insurance cover for 50 crore people. So who will be benefited? People with the low cost will benefited. And where this patient will go? To these hospitals, because X type of hospitals which have incurred 1.5 crore cost, they cannot afford to treat this patient. As far as states are concerned, because healthcare is a state subject, Gujarat government has given interest subvention of 4% to us in our all new projects. So we are actually paying 3.5%. GST exemption for 7 years. So actually governments are doing lot, which is the investor community is not aware about. So these are all different tax incentives, which we can talk in detail when we meet one-to-one. These are state-related incentives. Now what we are doing now, as I said earlier, we are building Nashik and Baroda. Somebody is building and giving us on a revenue sharing. We are going to equip it. So that cost we are going to incur after about 1 year. Bombay, Santa Cruz, Asha Parekh Hospital we have taken over, and we are scrapping it off and making a new hospital, about 175 beds. And Mumbai, Ghatkopar, one Middle East businessman is coming up with a hospital which we are going to run. He's going to equip it and he's going to give us working capital. We are going to get 4% out of whatever work we do. Thank you very much. Any questions? Yes, please.
Thanks for the presentation. There's a simple question. Your cost is low, so how does the revenue match up for a normal like say knee pre-placement surgery? How much is it? So Apollo will take 2 lakhs for a package. So how much will you take?
See, top, as I earlier said, that all airline tickets are at same price. Same way, the price of operation are decided by the city economics. You go to Ahmedabad Apollo has the same price of Shelby. Sterling has the same price of Shelby. Delhi you go, Max, Fortis, Apollo, the same, almost same, 2 to 5% difference. There is no difference.
And
if you see our ARPOB is much higher than all of them. You know ARPOB, average revenue per occupied bed.
And what is the spectrum you're doing? You're doing orthopedics and you're doing everything? Or?
See, basically what happens is any hospital or a healthcare infrastructure, like Apollo, tip of the arrow was cardiology. And now it is known as multi-speciality. So even if today you think about Apollo, you think about heart. Similarly, HCG, the tip of the arrow is cancer. For us, tip of the arrow is orthopedics. And the full arrow is having everything, full multi-speciality, because this is all geriatric practice. You can't run one branch. You can run one branch in dental and ophthalmology, because it's not related to system. Otherwise, in any geriatric branch, you need support of all other branches. And why not to do that business then?
Excuse me. Just wanted to have your guidance on the government is putting cap on the implant, stent and all. So the price of the surgery is still not coming down. So
It will not come down. That's what I'm saying. You know, the government is not against healthcare providers. They have put a cap on implants because they want Indians to get a cheaper implant. But at the same time, hospitals have increased the price because they are hardly making money. If you see, forget about us because we are efficient, but all other hospitals, EBITDA is 8%, 10% now. If you reduce price, if they had some margin there, if they don't take it from somewhere else, they will be closing down. So you are absolutely right that overall prices have not come down, that they have gone up because they will not survive. The cost structure is such they are having.
yeah, another question is one of the doctor in South has invented some surgery which is replacement of the joint replacement kind of thing. So the cost of the surgery will come down. So will it not have an effect on the overall profit of the hospital?
I tell you what, all the innovations and invention happen in Germany and Japan and US. I tell you, if something to come up in US first, 800,000 knees and hips stop first. Those companies are investing billions of dollars because they know that genetic engineering, which I showed earlier, is 50 years away. बाकी इंडिया में तो फिर वो पानी में से भी पेट्रोल बनाने वाले आ जाते हैं ना. That's it. Thank you. Oh, please.
Sir, could you give us some sense of this new health insurance plan that the government has announced? I know the specifics are not out, but some idea of what you think the pricing could be and what the implications could be or potential issues with a plan like this?
Sure. First of all, it is a 10,000 crore payout for 50 crore population, 10 crore families. 5 lakh rupee floater for 5 people family, so 1 lakh rupee each. But one person can spend 5 lakh and then the whole thing gets over for rest of the people also for a given year. Government will be paying 60%, central government will be paying 60% and state government will be paying 40%. And all state yojanas will be closed, like Gujarat has Ma, Maharashtra has Jyotiba Phule, Rajasthan has Bhamasha Yojana. These will be actually merged. And they are going to start working from 1st April. Whomsoever were registered for 30,000 rupees Bima Yojana, they are going to be getting straight away enrolled in this. Then Aadhaar linked, they are going to start enrolling. And those people who are already enrolled in Ma Yojana of Gujarat, they are automatic beneficiaries. As far as what they will pay per surgery, which is more important. Now, as on today, state government are paying X amount for anything. The central government bodies are paying more than that amount, like CGHS, ECHS, or even National Bal Swasthya Yojana. They have better rates than state Yojana. So, actually, they are going to be better than states.
Hello, sir. So recently, Gujarat government has identified education as one of the basic amenities, and they are trying to cap the fees at 15,000 rupees, even for a IB and a IG school. So would you think that there is any scope for medical also to come, become a part of the basic services?
See, if they do it, let us say for the God's sake, they will do it. Then we will be the only people surviving. There will be no healthcare company surviving. Believe me, because if you do that, people with 8 and 10% EBITDA margin, they will be wiped off. They cannot afford to lose millions of jobs. They know it. They know it, and after capping implant for 2 times, now no further cap is coming at all. And rather than capping or anything, they are coming with insurance, and what they are doing is they are putting cap on the procedure, what they are going to pay. So already there is a cap. See, what happens in insurance, even today's insurance in GIPSA, you have 70,000 rupees for appendix. So it is capped. Why government should cap? So as on today, why all the other hospitals' EBITDA margins are under pressure is because of this, because insurance companies are trying to reduce the prices, and when they are reducing the prices, their margins are coming in pressure. So overall price cap is coming because of competition, because of insurance companies, and because of yojanas like this, where they decide that this is the amount fixed. You want to take it, take it. You don't want to take it, don't take it. So there is no point then to cap the price for given hospital.
Thank you, sir.
Good afternoon, sir. I joined a little late. I don't know whether you mentioned about it, but taking forward Shalby's expansion plan, would you be interested in constructing your own hospitals, or would you be going for acquisitions of hospitals, or just manage and operate, or a mixture of all three?
We do everything. See, Jaipur we built, Surat we built, Naroda we built. Mohali we bought the old unit, fully renovated it and running it now. Vapi we bought ready hospital and running it. So we do everything. We want to see only one thing. We have to get our money back in 5 years. If we are not able to, we don't want to do that.
What is more better for you in terms of turning around the whole setup that is there, if at all you take
See,
it?
as I said earlier, if you give one of the investors in Hong Kong asked me that if I give you max, would you run it? I said, if I sit on elephant, I cannot make him run even after 20% weight reduction. So as I said earlier, I can't change. See, why Sahara thing failed? See, Jet Airways bought Sahara and it did not work out for Jet. So unrelated acquisition is a big problem, and most of the acquisitions fail because of this, because you have not thought through. You are emotionally buying because you want to grow. So we don't want to do that.
Sir, here.
Sorry.
So, as investors, we always feel there's a regulatory risk investing in hospitals, because there's a general perception that they are always overcharging patients, and you have seen cases in Bengal and Gurgaon where state government has intervened and court has intervened and saying you're overcharging patients. But on the other hand, you see 8%, 9% EBITDA margins. So what is your view on that? Is this constant conflict a healthy thing, or how do we resolve this?
See, I tell you what, healthcare is a holy cow. Healthcare is a holy cow where, government of the day and political parties also want to milk them. Media also loves to play it again and again. So it is like that. Having said this, in corporate world, it is difficult to overcharge somebody because the hospitals are run on softwares and billing is done on software and owners are sitting somewhere else. So it is not overcharging, it is misconception. So many a times, what has been happening is that patients and relatives are not taken in confidence, number one. Number two, other thing is, even we as a Shalby, what we do is, if patient dies and if 50,000 rupees are to be taken, we don't say we will not give it. We just forget about those 50,000 rupees. For us, reputation is more important than those 50,000 rupees. So we are not able to save that patient. Why we want money from them? So थोड़ा छोड़ भी देना पड़ता है. वो अभी कई लोग छोड़ने को तैयार नहीं है, तो फिर वो दुखी होते हैं ज़्यादा. It affects their reputation more. And they have to do it because they work with such a low margin. They are not cost efficient. So their CEOs and CEOs are having constant pressure that you don't lose money. So, it's a negative cycle for them. And as far as government is concerned, government jolly well knows that poorest of poor, if given chance, doesn't want to go to government hospital. That they realize. And that is why first time ever insurance thing has come for 40 crore people. Government has realized in 70 years what they have provided to common men. And that is what you can see. And this is an opportunity.
Thank you.